IPSC 2020s. The conference theme of this is exploring public health challenges and development in a globalizing world. That is very appropriate theme. Theme has been chosen by this International Public Health Conference, Singapore. And once again, thanks a lot by Amrita Sharma ma'am, your kind words. Can you see my presentation or slides?
Yes, we can see your presentation.
Yes, okay. So today's topic of my keynote presentation is the public-private partnership in health and nutrition, a case study of iodine deficiency disorders in India. First of all, I would like to greatly acknowledge the contribution of my mentor, Padma Shri Dr. Chandrakant Pandav, that awardee for his work in medicine in the year 2021 by the Government of India. Chandrakant Pandav, Dr. Chandrakant Pandav is a former professor and head of the Department of Center for the Community Medicine at All India Institute of Medical Sciences, New Delhi, AIIMS, New Delhi, India. Now presently, he is a member of the National Council on India Nutrition Challenges under the Poshan Abhiyan, which is chaired by the Vice Chairman of the Niti Aayog, Government of India. Chandrakant Pandav is also known as the Iodine Man of India, as he has been a relentless crusader in the fight for sustainable elimination of iodine deficiency disorders, that are single most important cause of the mental handicap worldwide, according to the WHO. Chandrakant Pandav work subsequently led to the concept of extra Himalayan fortification of the endemic goiter, and he also conducted in-depth economic evaluation of the IDD control program and provided conclusive evidence for the cost effectiveness and cost benefit of IDD control intervention in program mode. His research and advocacy has contributed enormously to the success of the National Iodine Deficiency Disorder Control Program and mandatory universal salt iodization, not only in India, but the worldwide. So coming to my presentation, according to the World Health Organization, iodine deficiency in the fetal life and early childhood remains the single most important and preventable cause of mental retardation globally. Even the mild iodine deficiency can prevent the children from attaining their full intellectual and physical potential. Sustainable elimination of iodine deficiency disorders is directly linked to the economic growth of the children. The IQ score of the children living in an iodine deficient environment is nearly 13.5 IQ points less than those living in the iodine sufficient environments. So near about 13.5 IQ points less than the living in the iodine sufficient environments. A 1 point increase in nation's average IQ is near about associated with the 0.11% increase in the GDP. So therefore, 13.5 IQ point increase ultimately results in the 1.49, near about 1.5% increase in GDP. So GDP of the India for the year 2019-20 was 2.8 trillion USD. The increase in 1.5 would amount to the 42.7 billion USD. So that is the scenario. Because the iodine deficiency is a disease of the soil. Because if the soil is deficient in the iodine, the food crops grown on that soil are also ultimately deficient in the iodine. So salt, because of its unique characteristics, is an ideal fortification vehicle, and it is commodity inversely consumed by all, either it rich, poor, your male and female, even urban and rural, young and old, even in summer and in the winter. So it's a unique characteristics of this salt. Everybody has consumed by all. So each individual consumes on an average 10 to 12 grams of the salt per day. Because salt is therefore fortified with the iodine under the Universal Salt Iodization Program to address the IDD in the countries. Since the implementation of universal salt iodization in India, it achieves remarkable success. And as of now, iodized salt reaches 92.4% of the population in the country as per the India Iodine Survey 2018-19. So universal salt iodization is one of the most successful public health intervention. It has been credited with the elimination of IDDs in the world. If you see the magnitude of IDDs in the worldwide, because IDDs is a global problem, as per the WHO, it estimates point out that more than 7% of the world population suffer from the iodine deficiency. And in the developing countries alone, it was estimated that near about 800 million people are at risk of IDD, and 225 million had goiter, 3 million were cretins, and 20 million had the mild neurological disorders. Many babies are born the cretins who are mentally retarded, physically stunted, deaf, mute, or some paralyzed. Even similarly, there are stillborn, many more have IQ at least 10 points below their potential. So this is the magnitude of the IDD in the worldwide. If you see the magnitude of the IDDs in India, because India IDD have been also recognized as a public health importance in India since 1920. It was estimated that around 200 million people are at risk and 70 million estimated to be suffering from the IDD in India. Unlike other micronutrient deficiencies, IDDs are more due to the deficiency of iodine in water, soil, and foodstuffs, and it ultimately affects all socioeconomic groups living in that particular defined geographical area. Initially, iodine deficiency disorders was thought to be a problem in sub-Himalaya region in our country, but however, the survey carried out in India subsequently showed that there is not a single state is completely free from the IDD. That means all the states and UTs of this India is 1 and 2, there may be some cases. So not a single state is free from IDD. So the realizing this magnitude of the problem in India, in 1962, the government of India launched the 100% centrally assisted National Goiter Control Program. In 1984, the government policy decision has to be to universal iodization of edible salt was taken by the government of India. In August 1992, the National Goiter Control Program was renamed as the National Iodine Deficiency Disorder Control Program, NIDDCP, taking into its ambit the control of a wide spectrum of IDDs like mental and physical retardation, deaf mutism, cretinism, stillbirth, and abortion, etc. The IDD is 100% preventable worldwide. So iodine is a very essential micronutrient and element, and it is necessary for synthesis of the thyroid hormone, that is T4, and triiodothyroxine, that is the T3. Because the thyroid regulates the wide variety of the vital physiological process, such as early growth and development of the brain and body in the man. There are so many scientific studies in India and abroad have evidence that nutritional iodine deficiency causes the deficiency of thyroid hormone during fetal life and childhood itself. Then question arises, why the iodine deficiency? Yes, because the iodine is only present in the soil, and hence IDDs are environmental problem. And in epidemiological triad, you know there are epidemiological three things are agent, host, and environment. So out of these three epidemiological triad, agent, host, and environment, who plays the greatest role? Of course, environment plays the greatest role, and the iodine is present in the soil, and that is a big environmental problems. So iodine deficiency results from the geological rather than the socio-economic conditions. The problem aggravated environmental factors such as accelerated deforestation and soil erosion. Iodine is present in the top crust of the soil, frequent floods cause the washing of iodine from the soil crust, and same happens when the glaciers slide down mountains. Unlike the nutrients such as iron, calcium, or vitamins, iodine does not occur naturally in the specific foods. Rather, it is present in the soil and is emitted through the food grown on that soil. The ideal situation is whether the daily needs of iodine are met natural foods grown in iodine-rich soils. Food grown in iodine-deficient region can never provide enough iodine to the population and livestock living in such areas. Then, if the area is an iodine deficient, so there is no question of elimination of IDDs by changing only dietary habits or eating certain kinds of foods grown in that area. The correction has to be achieved by supplying iodine through external source, and that can be done by only fortifying the commonly consumed food with the iodine. Then what is solution for this? Yes, there is a solution, and the solution is iodization of the salt, and that the iodization of the salt is a long-term and sustainable low-cost solution, which will ensure that iodine reaches the entire population and is ingested on a regular basis. Fortification of the salt, which iodine has extremely successful in eliminating the iodine deficiency all the world over. So this is the solution. Then how you see the requirement of the iodine? So iodine is I already told you, iodine is an essential micronutrient. Normally, daily requirement of the iodine is 100 to 150 microgram, which is absolutely safe for the normal growth and development. Iodine deficiency produces the wide spectrum of disorders, and these disorders caused due to deficiency of the iodine, that is known as IDDs. So these are the table showing the age groups and requirements in micrograms of the iodine. If you see the infant, that is a 0 to 1 year, it near about 100 microgram is a requirement. Children 12 to 16, 1 year to 5 years, 90 to 120 micrograms. Children 6 to 9, 120. Adults and adults is more than 10 is 150. Sorry for interruption. Pregnant and lactating woman is requirement is 250 to 280 micrograms of the iodine. I already told you the spectrum of IDD. If you see the fetus, there are chances of abortion, stillbirth, congenital abnormalities, increase the perinatal mortality, increase the infant mortality. If you see the neurological cretinisms, including the mental deficiency, deaf mutism, spastic diplegia, spin. If you see the myxoedematous cretinisms, including the dwarfism, mental deficiency, psychomotor defects. If you see the neonatal, there are neonatal goiter, neonatal hypothyroidisms. If you see the children and adolescent, there is again goiter, even juvenile hypothyroidisms, impaired mental function, retarded physical developments. If you see the adult, goiter with the complication, even hypothyroidism or impaired mental function. These are the spectrum of fetus, neonates, children, adolescents, and adults. Then how you assess the severity of IDDs? So there are epidemiological criteria for assessing the severity of IDDs. The WHO has fixed the criteria for classifying the IDD as a significant public health problem. And these are the 3 to 4 indicators. The first indicator is an TGR, that is the total goiter rate, that includes the grade 1 plus grade 2 goiter, that is the total goiter rate, grade 1 and grade 2. Median urinary iodine excretion, thyroid volume by ultrasounds, salt iodine contents. If you see the indicator, the table shows the whole of the target population, and when you see the severity of public health problem in one prevalence, divided into 3: mild prevalence, moderate, and severe. If you see the goiter grade more than 0, the target population is school age children, 6 to 12 years. And severity of public health problem is shown in the tables. Similarly, thyroid volume by ultrasound, TSH, thyroid stimulating hormone is more than 5, median thyroglobulin, the target population is neonates for TSH, and median thyroglobulin is target population children and adults. And these are the prevalences of the mild, moderate, and severe. Coming to the classification of goiter, as per the WHO publication 1994, the goiter has been classified into 3 grades: grade 0, grade 1, and grade 2. Grade 0 means there is no palpable and no visible goiter. That means there is no goiter, that's the grade 0. Grade 1, when you say grade 1, it's an grade 1, a mass in the neck that is consistent with an enlargement or thyroid that is palpable but not visible. When the neck is in a normal position, it is moved upward in the neck as a subject swallow. That means goiter is palpable but not visible. Grade 2, a swelling in the neck that is visible when the neck is in the normal position and is constant with the enlarged thyroid when the neck is palpable. That means goiter is visible and also palpable. So grade 2, goiter visible and also palpable. Then when you elimination of the IDDs. For a sustainable elimination of IDD, the following 3 criteria are important to meet. To ensure the 15 ppm of the iodine in the salt at consumer level and 30 ppm at the production level. Second criteria should be made to median urinary iodine excretion. That should be the 100 microgram per liter. And third criteria is to TGR, that is total goiter rate. That is the percentage of the school age children 6 to 12 years with visible and palpable goiter. That means grade 2 should be less than 5% as per the WHO. Then coming to the public-private partnership model. What is the public-private partnership model? Public-private partnership model refers to any arrangement between the government and private sector, because PP, it indicates public and private. These are the 2 things. So it's an arrangement between government and private sector for the common good of the people. While the public sector is seen as an representing a pool of the resources to the delivery of the public services. Public sector is regarded for its ability to harness its expertise in realizing substantial increment values of those resources. So public sector is potential will not be fully realized without the private sector. So there must be combination of public as well as private, because public sector potential will not fully realize without private sector. So private sector participation can expand opportunities with new and innovative approaches and better business and management expertise. The benefits of working with the private sector that include the improved access and reach better efficiency, opportunity to regulate and establish the accountability, improve quality and practice rationally. So that is the benefits of working with the private sector, because there is a better efficiency, there is an opportunity to regulate and establish the accountability also, to improve the quality also and practice rationally also. So that's a need to combine with the public-private partnerships. Given the respective strength and weaknesses of both the sided, neither the public sector nor the private sector alone is in the best interest of any program, including sustainable universal salt iodination program also. So there is a need of the public-private partnership, and that's why the public-private partnership model has been accepted. There are few examples of the public-private partnership in the field of health and nutrition, especially in India. There are so many few, and of the few, none are as the large scale and significant as in the cause of the universal salt iodization program. So it is well known that most efficient method of assuring the adequate intake of the iodine in the diet over a time at the night cost to the large population is through the daily consumption of iodized salt, which is the product of the market and that about to be sold in the marketplaces like in villages, in tribal areas, in towns and cities all over the country every day. The farming, the processing, the packing and the marketing of the salt in India is largely in hands of the private entrepreneurs. So more than 90%, 95% of the salt production in the country is handled by the private sector. So near about 95% of the salt production in the country is handled by the private sector only. So in such situation, effective and sustainable elimination of iodine deficiency disorder will only be possible if the public sector and private sector both are collaborate in perfect harmony to develop, to produce, and to promote the daily use of adequately iodized salt. So public sector, which has mandate and responsibility to improve the health and nutrition of the population, and government of India is supplying through the public sector, and the private sector, which has experience and expertise. So public sector is responsible to improve the health and nutrition of the population. Subsequently, the private sector, which has experience and expertise in food production and marketing, are clearly two very important pillars. So there is a need to public and private partnerships, and that's why the model is developed. As a result of their synergy, success has been achieved, and we are all benefiting from it. Over the years, surveys have shown that there has been admirable achievements toward the sustainable elimination of IDDs. From the various national surveys, such as National Family Health Surveys, Comprehensive National Nutrition Surveys 2016 and 18, India Iodine Surveys IS 2018-19, one can see that the cooperation from the salt industry, that is the private sector, is one of the key factors in achieving high coverage of adequately iodized salt in India today. So engagement with the medium and small scale producers with focus on the improvement in quality of iodized salt through the maintenance of quality assurance has been one of the prime reasons for improvement household coverage with adequately iodized salt. If you see the PP model in health care in India, so there is a regulation in terms of improve the standards, get the accreditations, and you have to fit for in the legal framework. So you have to improve or maintain the standards, getting the accreditations, and always you have to fit in the legal framework of that to follow the regulations. If you combine with that the institutional system by the PP policy, so ultimately there should be the quality control and capacity buildings. If you both the summit, the PPP model will be successful in terms of efficient service delivery and ultimately the infrastructure also. So this PPP model in healthcare India is so much very successful. The way forward, because the coverage of adequately iodized salt for sustainable elimination iodine deficiency disorder is progressing. However, it still has not reached to the target of more than 90% coverage of adequately iodized salt. As per the latest data reported in India, Iodine Deficiency Survey IIMSR 1819 conducted by All India Institute of Medical Science, Nutrition International, Indian Coalition for Control of Iodine Deficiency Disorder, ICC-IDD, and Kantar, 76.3% of the population in India consume the adequately iodized salt. So iodized salt coverage in India has increased from less than 5% in 1980s to 93% in 2018-19. And this alone has resulted in saving 4 billion IQ points since 1985. And this has been achieved due to the public-private partnership model. So estimated population in India as in 2021 is 1.39 billion. 76.3%, I already told you, of the population equates to 1.06 billion, and which is roughly equal to the population of 155 countries in the United Nations. So it's a very significant percentage of the population, 23.7%, continues to consume the inadequately iodized salt 16.1%, or even nil iodized salt 7.6%. So thus there is still need to reach to unreached population, and the way is public-private partnership model. Then what will the audience learn from this my presentation? The harmony and enhancement of partnership between public and private sector. So harmony and enhancement of the partnership between public and private sector is one of the elements that needs to be strengthened to ensure sustainable elimination of iodine deficiency disorders. Therefore, the PPP model is very much required to cover the last mile of the universal salt iodination program in India. With this information, audience would definitely encourage to have the risk regarding IDD and role of PPP model, public-private partnership model in eliminating various nutritional disorders. So sustainable elimination of iodine deficiency disorder is possible by daily consumption of iodine salt by all as per the Millennium Development Goal 2015. If it can be done, it should be done. It must be done. Further delay is unacceptable. Further generation will not forgive us for not doing it. So these are my references. My presentation has been made. Thank you very much. Over to Dr. Amrita Sharma.